Hello all, this is my manual muscle testing video for the lower extremity. We'll start with trunk flexion. So we'll start with the patient laying supine, lay on your back. And then while the patient's laying supine, we'll have you put your arms behind your head. We'll palpate the abdominal muscles, like this. And now have her do a sit-up all the way. Perfect. So we're applying no resistance for trunk, but what we're looking for is do a sit-up again. You can palpate a contraction, but we're looking for the inferior angle of the scapula to clear the bottom of our table. So for grade 5, she did it all the way. The inferior angle cleared the bottom of the scapula, or the inferior angle cleared the bottom of the table. If she wasn't able to do that, I'd have you cross your arms over your chest and then do a sit-up again. We'll palpate the abdominal muscles. The inferior angle of the scapula, is able to clear the bottom of the table. That's grade 4. Grade 3, I'll have your arms at your side and then do a sit-up again. Perfect. The inferior angle of the scapula clearing the table, that's a grade 3. She's doing that in a gravity or an anti-gravity position. For grade 2, you can keep your arms at your side, and then for grade 2, she'll be able to lift her head or neck a little bit, but not get the inferior angle of the scapula off the table. That would be a grade 2. Grade 1 is there's going to be no range of motion, so she'll try to do like a sit-up, but I can palpate a contraction in that rectus abdominis. Grade 0 is there's no movement with no contraction. Next, we will do hip flexion. So I'll have you sitting right at the end of the table here. So we're looking at the psoas muscle and the iliopsoas muscle for hip flexion. Get a little bit even closer. So we'll stabilize the iliac crest, and then we're testing for the psoas and the iliopsoas muscle. So flex your hip. You can kind of hold on to she's able to do that against gravity. That is a grade 3. So then we'd go to a grade 4. So stabilizing the iliac crest. I'll have you move it up into about 90, and then I'm going to push down on the distal anterior femur. This is moderate resistance, and she's able to do it against moderate resistance. That's a grade 4. Then bring it back up again, 90 degrees. Perfect. Stabilizing the iliac crest, pressing down on the distal anterior femur. We're going to do it against maximum resistance. She's able to do that against maximum resistance. That is a grade 5. For grades 2 through 0, we'll have the patient side lying, with the testing leg is going to be against the table. So we'll have it this way for that. I'm going to support I'm going to support this leg, kind of get it out of the way. And then for this one, you're going to flex your hip. Perfect. So we're doing that in a gravity minimized position. So do that one more time. So it's the bottom leg is on the table. The testing leg will be on the table. Next, we'll palpate the psoas and the iliopsoas muscles. For a grade 1, she'll be trying to flex the hip, but you can't, but you'll have a palpable contraction. Grade 0, there's no movement with no contraction. Next, we're going to be testing knee flexion. So that's the hamstring. So I'll have you lay prone. Now try to touch your heel to your butt. Doing that in a gravity or an anti-gravity position. She's able to do it against gravity. That's a grade 3. For grade 4, bring it up. I'm going to have you rotate the foot out laterally a little bit. We'll stabilize at the pelvis and the iliac crest. And then I'm going to try to apply resistance kind of right above the malleolus. she's able to do that against moderate resistance, that's a grade 4. Do it again, and then since the muscle we're testing is on the lateral side, we have to rotate the foot out laterally. Stabilizing and pressing, able to do it against maximum resistance, that's a grade 5. And then we'll have you side lying for grades 2 through 0. So side lying, we're going to have you again with the testing leg on the bottom, supporting this one, taking it out of the way. We're going to start with the knee in knee extension, and then you're going to go into some knee flexion. Doing this in a gravity minimized position, that is grade 2. Go back to knee extension. We're palpating the hamstring muscles, supporting the non-testing leg. Grade 1 is she'll be trying to move it. There will be no movement or little movement, but a palpable contraction in the hamstring muscles. Grade 0, there is no movement with no contraction. Lastly, plantar flexion will be our last one. So I'll have you standing for grades. So kind of do like a calf raise, stand up on your tippy toes. Perfect. I'm going to move this so we can. So stand up, do some calf raises. Perfect. So we've established a range of motion now. All right, go and touch my head. Perfect. Do that, keep doing that. 2, 3, 4, perfect. Now we're gonna test one leg, so you'll stand on one leg, do it, and now touch my head. And you can grab onto me for support if you need. 2, 3, 4. Okay, so you can stop. So for grade 5, if she's able to do 25 reps of hitting the desired landmark, hitting her head on my hand for this one, 25 reps is a grade 5. If we're able to do 10 to 24 reps of that, that is a grade 4. 1 to 9 reps of doing that is a grade 3. I'll have you lie prone for grades 2 through 0. So we're lying prone with our foot. You can scoot a little bit closer. We'll have the foot hanging off the table. And now I will have you plantar flex your foot, whichever foot we're testing. Perfect. She's plantar flexing her foot. She's able to plantar flex in a gravity minimized position. Now we're going to be the calf muscles, the the soleus and the gastromeniscus. You can plantar flex again, or try to. There's little movement of plantar flexion, but you can palpate a contraction. That is grade 1. There is no movement, no contraction. That is grade 0. Thank you all. That is my testing video.